Welcome to another video. In this video we will continue our respiratory section and learn about complications of COPD. The main complication to note is cor pulmonale. Cor pulmonale is right-sided heart failure caused by pulmonary disease. Manifestations include hypoxia and hypoxemia, extreme dyspnea, cyanotic lips, jugular vein distension, dependent edema, hepatomegaly, and pulmonary hypertension. Hepatomegaly is an enlarged liver. As a nurse, what are the important nursing actions to take when caring for a patient with cor pulmonale? Nursing actions include monitoring respiratory status, monitoring cardiac status, assessing for indications of right-sided heart failure, administering oxygen therapy as prescribed, ensuring adequate rest periods, encouraging low-sodium diet, maintaining fluid balance, and administering medications as prescribed. Medications for cor pulmonale include diuretics and digoxin. Therapeutic measures for cor pulmonale is mechanical ventilation to assist with breathing. Now, let's go over carbon dioxide toxicity, which is also known as hypercapnia or hypercarbia. This causes dangerous levels of CO2 in the blood. In most cases, it signals a respiratory problem such as poor lung function. Contributing factors include carbon dioxide retention and excessive oxygen delivery. A patient with carbon dioxide toxicity may present with alteration in level of consciousness, tachypnea, increased blood pressure, and tachycardia with dysrhythmias. Patient care will include the following: monitor pulse oximetry and ABGs. Avoid excessive concentrations of oxygen. Provide pulmonary hygiene. Provide ventilatory support with CPAP, BiPAP, or mechanical ventilation. Now, the last part of this lesson we will learn about is pneumonia, which is an inflammatory process in the lungs that produces excess fluid and exudate that fill the alveoli. Pneumonia can be classified as bacterial, viral, fungal, or chemical. There are several contributing factors, which are advanced age, no pneumococcal vaccination within the last 5 years, no influenza vaccine within the last year, chronic lung disease, immunocompromised, mechanical ventilation, postoperative sedation and opioid use, prolonged immobility, tobacco use, and enteral tube feeding. Signs and symptoms include tachypnea and tachycardia, sudden onset of chills, fever, flushing, diaphoresis, productive cough, dyspnea with pleuritic pain and crackles. Other indications also include the patient having an elevated WBC and decreased oxygen saturation. The nursing actions for pneumonia include the following: assess respiratory status. Administer oxygen. Assess sputum. Monitor vital signs. Encourage 3 L of fluid per day. The medications for pneumonia are anti-infectives, antipyretics, bronchodilators, and anti-inflammatories. Important client education is to teach correct medication administration, preventive measures, and teaching the importance pneumonia and influenza vaccine. That's it for this video. In the next video we will continue the lesson by learning about tuberculosis. See you there. Thanks for watching.